Welcome back. Well, hypothyroidism affects more than 20 million Americans, but many may be misdiagnosed. Here to tell us more, please welcome to AM Northwest the author of Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal, Dr. Dutas Karazian. Good to have you with us. I'm pretty sure I pronounced your first name incorrectly, so I apologize for that.
Dutas, yeah.
Dutas. So let's talk about hypothyroidism and hyperthyroidism, and tell me about those two and the difference between the two.
Hypothyroidism is when the thyroid itself is not functioning well, it's not doing its job making hormones. Hyper, it's when it's overactive. Most hypers are autoimmune. There's an autoimmune process, the immune system is attacking the thyroid. That's when they become hyper. But most hypothyroid disorders are also autoimmune. And most people don't know that. Most people think they just have a hypothyroid condition, but they really have an autoimmune disease.
And what are symptoms of, let's start with hypothyroidism. What are the symptoms people would be looking for?
If people are hypothyroid, they get fatigue, they get depression, they get constipation, they get sluggish mental activity.
You're describing everybody.
Yeah. Well, the thing with thyroid hormones impact every single cell in the body. So when a person doesn't have thyroid hormones, they have such global types of symptoms, but fundamentally their metabolic rate goes down. Thyroid hormones control the metabolic rate.
So I'm guessing that hyperthyroid would be just the opposite.
People that are hyper have anxiety, nervousness, inward trembling, but people that have Hashimoto's, they go back and forth. They have some inward trembling, nervous insomnia, then they get constipation, depression, mental sluggishness, and they go back and forth. Because what happens with most people that have hypothyroidism, they don't really know they have this underlying autoimmune process, and the autoimmune process has relapses and remissions. So it flares up, and then it calms down, and it flares up, and it calms down. So a lot of times you'll see people have symptoms of both.
So is Hashimoto's a type of hypothyroidism?
Yeah, most hypothyroidism today is actually Hashimoto's.
And
describe that for us.
So here's what happens. What happens is a person goes in, has these symptoms, they finally get their thyroid diagnosed. They get diagnosed hypothyroid. But what they don't have done is they don't have thyroid antibodies done. And there's a test called TPO antibodies and thyroglobulin antibodies. And this test is never done with them. So they don't really know they have an autoimmune process. And the healthcare system doesn't do this test because it doesn't change treatment. So these people leave thinking they have a gland disorder, but in fact they really have an autoimmune disorder. And this is very important for us because the studies are showing that between 50 to 60% of Hashimoto's people, or so-called hypothyroid people, have antibodies against other tissues. So the unfortunate thing is these people really have this autoimmune disorder. As time goes on, they start having other types of conditions develop, like their joint pain, may be arthritis down the road. They may have antibodies to their intestinal cells, have inflammatory bowel disease, or things like that. So the reason I wrote this book is because these people that are being diagnosed hypothyroid don't really know they have an autoimmune condition. The healthcare system isn't really identifying that for them.
So this autoimmune condition, these are things people introduce to their bodies via food, via environment?
Well, we all have a genotype that has certain diseases that we're susceptible to. And then we have what's called the phenotype. That's the genes plus environment and diet and lifestyle. So when you have the combination of genes and environment, at a certain mixture, you can have certain disease processes turn on. So we don't know what all the triggers are. We know hormones are a trigger. There's 24 to 1 ratio between males to females to males for Hashimoto's. We know there's certain dietary proteins, gluten, like that's found in wheat, has been shown to be a trigger.
Are you suggesting that people try the gluten-free diet then?
Absolutely. If you really look at the scientific literature, in the book I wrote, I have over 600 references in the book, and I just got tired of putting more in. But at this point, I think it's pretty much almost like malpractice for a person to have Hashimoto's and not be on a gluten-free diet and be told about it.
Somebody who's been diagnosed with hypothyroidism, what would they have to do to find out if they have Hashimoto's? They would go to their doctor and ask for these specific tests?
What they really need to do is, first of all, they have to get diagnosed hypothyroid. Most already know they're hypothyroid, but most don't have their thyroid antibodies done. And the reason the healthcare system doesn't run the antibodies is because it doesn't change care.
Right.
Whether the antibodies are positive or negative,
but care can change because your lifestyle would change. You would change your diet.
Well, that's the thing. The consciousness, the perception of what the patient is going through is going, you know what? I have an autoimmune disease. And one of the things that I see with my patient population is I run multiple tissue antibodies. So, for example, if someone has antibodies against their thyroid, that means their immune system is tagging this tissue to destroy. But you'll see antibodies against their cartilage, you'll see antibodies against their myelin, you'll see antibodies against their intestinal cells, and then you look at the big picture and go, you know what, you're having potential destruction in other areas as time goes on, and if you don't dampen the autoimmunity of it, that this can be a problem. So the thyroid hormones themselves don't dampen the autoimmunity. They're necessary for the person to function and have bone health and prevent brain degeneration and things like that. But there's this whole autoimmune destructive component, and the conventional healthcare system, for autoimmune diseases, they use steroids, and they just don't consider steroids to be efficient enough.
So I'm hearing you say that catch it early and begin working with it, and then you'll save yourself trouble down the road. So people need to talk to the doctor about those other tests.
They have to demand it. There has to be a consciousness to what they really have.
Sure.
Because these people that have hypothyroid think their gland just didn't work for some reason, and then they don't know.